Mohammed Anwer Hanif is the coordinator for the Health Equity Right Programme at CARE Afghanistan, and he joins us now via Skype from Kabul. Sir, great to have you with us. I believe you have team members already on the ground. Can you confirm that for me, and you can tell us what they're finding?
Yeah, thank you so much. Actually, we started a response this morning along with other partners, humanitarian agencies. So we deployed 3 mobile hill teams, one from Ghazni province, neighboring to Paktika, and we were able to reach there. The second one is in Paktia with the regional hospital supporting the casualties evacuation transportation. And the third one is in Spera district of Host. So the situation, and as mentioned on the ground, is unfortunately very bad. Still, the rescue support is in progress, and we are taking people out of the mat and shelter destroyed. As mentioned, there is a very high risk of more casualties. So we are providing medicines, medical supplies, some of the non-food items, also supporting food through multi-purpose cash assistance. We are having medical doctors, midwives, psychosocial counselors who are supporting people on the ground.
I mean, your team have operated in these kind of conditions before. We mentioned all the challenges, weather, the broader issues that much of the country is already facing in terms of financial issues. How much capacity do you have here to provide support? And what are officials saying? Are you working with them too?
Yeah, actually, there are some key challenges. Supply chain is facing challenges because of the shortage of the medicine, even in the private market. Also, international supply is taking very long time. We are having some of the pre-position stocks of the items. So we are using those ones along with other partners. We are supplying. The other challenge is access. So when you are going to the areas, especially in remote areas, there is hard terrain, and it is very difficult in some areas, even for vehicle to go there. So we are going by walking. Our teams are actually carrying things with them to reach, and this is really a risk for those who we can keep them to survive. Actually, so delay is occurring, unfortunately.
Dr. Hanif, can you keep your people safe? Are they saying to you that the conditions are that challenging that they're worried about getting access to people? I mentioned that the fear is that there'll be far more casualties than we know right now. Are they having trouble even getting access to people?
Yeah, exactly. Actually, access is a problem. Although we are in the nearest possible location, but now we were able to reach to the locations. But more support is needed, and more partners need to provide support, because the casualties are rising more and more, and we need a larger capacity actually.
Are you working with other aid organisations? And if people are watching and want to provide help, what can they do to help? What more do you need?
Yeah, actually, the UN Agency for the Humanitarian Coordination Assistance is coordinating all the partners together. WHO and others in the health sector, specifically health cluster. So we are jointly working to actually save lives. But multi-sectoral response is needed in terms of wash, shelter, non-food items. So all the partners need not only health, but also the other sectors. Now we are getting better and better as more partners are coming on the ground on different areas. But now, as the night is coming, so this night will be very challenging for people.
Sir, thank you so much for your time, and thank you for the work you and your team are doing. Mohammed Anwer Hanif there. Thank you.
Thank you.
Okay, let's check in on some of the other headlines.